Ah, Jimbo, good to see you.
Yeah, good to see you too. I wouldn't miss it.
Great, great.
Yeah.
So,
Everything okay? Belinda doing okay?
yeah, everything's okay. I think they're waiting for everyone to come on board here.
Okay.
And
Well,
let's see.
Jim, if nothing else, we're patient. We've learned that, haven't we?
I
Yeah,
don't know.
fair enough.
We're, I guess I was told by the staff, this is the awkward moment while we're waiting for people to come on.
Jim,
And
this is the Kenyon clock.
yeah, so yeah, I'll tell you about that. Oh, here we go. All right. Now we're up to 20. Yeah, I attended another event yesterday, organic chemistry. They talk about Kenyon time being, all right, we're 10 minutes behind. But
Yeah.
I'll tell you, at Case Western Reserve School of Medicine, when the meeting starts at 8 a.m., it starts at 8 a.m.
Yeah.
When the OR starts at 7:30, it starts at 7:30. Rounds start at 6 a.m., not 6:01, at 6 a.m. So that's what we try and teach our students.
It makes all the sense in the world to me. Yeah.
All right. So staff, I'm going to kick it off, and I'll be doing intros. So as people come in, they won't have missed, I would say, a heck of a lot.
Yeah,
so,
I think how late meetings start depends widely on or wildly on the institution.
Mm-hmm. Yeah. Well.
So as people are coming on, I'll start and say good evening, everybody.
Good evening.
And welcome to the healthcare panel at the virtual Kenyon reunion. I'm James Lieberman from the class of 70, and I would like to thank all of you for attending. Besides medicine present, I believe we're going to have some dentists, and those of you that may be from nursing or an allied health profession, if you could identify yourself via the chat room so we know you're here. We have Lindsay Cullopy from the Kenyon staff who's going to be monitoring the chat room, and she'll be assisting Q&A and our discussion. So we have a very ambitious agenda for the next hour. We will start, our first question is on liberal arts education. Is it worth it for students going into healthcare? And then we'll transition to COVID-19 and the pandemic that I hope we're coming out of. Then finally, we will have some comments on diversity at Kenyon, followed by what I hope to be about a 20-minute discussion that will land in at 8:15 Eastern time, a little more than an hour from now. So let's do the introductions. And again, I'm James Lieberman from the class of 1970 and tonight's monitor. I graduated from Case Western Reserve School of Medicine in 1974. Spent my whole medical career in Cleveland, Ohio. I was a diagnostic radiologist with interests in abdominal and breast imaging. I practiced at University Hospitals of Cleveland, Metro Health Medical Center, and finished off at the Cleveland Clinic. I've been retired very happily for the last 6.5 years. And in retirement, I'm quite active at the Case Western School of Medicine. I facilitate first-year medical students in their small group learning. I interview medical school applicants, and I serve on our School of Medicine alumni board. And recently I've had I'd say the privilege and very interesting experience of volunteering at COVID-19 vaccination clinics. Now let's go to our panelists. First up is Dr. Catherine Allan from the class of 1993. Catherine, why don't you tell us about yourself?
Thanks, Jim. Good evening, everyone. It's so nice to be here. I wish we were in person on campus. That would be even better, but I guess Zoom will have to do. So I graduated class of 93 as a biology major, and following Kenyon, I went straight to medical school at the University of California in San Francisco. After that, I did my pediatric residency, also at UCSF, before I moved to Boston for a fellowship in pediatric cardiology. And I have been here in Boston practicing at Boston Children's Hospital and Harvard Medical School ever since then. So I've been here for 20 years now. In addition to my clinical work, which is all focused on caring for critically ill children with either congenital or acquired heart disease in the intensive care unit, I also have an academic interest in using medical simulation as a tool both to train teams, but also to understand hazards in our healthcare environment. So I'll speak more about that tonight, but that's my brief intro.
Okay, our other panelist is Dr. Brad Dreifuss from the class of 2001. Go ahead, Brad, tell us about yourself.
First of all, thank you for having me. This is quite the honor. So I graduated in 2001 and took a year in Portland, Oregon, ended up going to Oregon Health and Science for medicine and public health combined training. And then went on to University of Connecticut for residency in emergency medicine. And from there, pursued an international emergency medicine fellowship at University of Utah and have been faculty of emergency medicine and public health at University of Arizona for the last now 9 years. So yeah, I'm an emergency physician. I work overnights and have been working in capacity development for emergency care for, I don't know, well, approximating 20 years, since that's what I was doing my semester abroad at Kenyon as well. And this past year during COVID, with some other friends and colleagues, partner, who are all Kenyon alum, Heather Green Dreifuss, Katie Crum, and Tim Shue, and others, we started a nonprofit called HCW Hosted to support healthcare workers and their families, and hopefully working to evolve how healthcare workers are integrated more as a focus into the quadruple aim for healthcare. So that's what we've been up to.
Okay, so let's dive in. And this is a true story. So in 1970, I was interviewing at a major medical school. They sat me across from 3 old guys in white coats, and they conducted a high-stress interview. One of them looked at my Kenyon transcript and asked me with a little smirk, "Why all these religion and philosophy courses?" And I gave it my best shot about the liberal arts and broad thinking, but I didn't convince them. So now in present time, when I do a case interview, I certainly don't act like this. And I have good information that the school in my story has changed their interview since 1970. Now, nevertheless, I could get this question from a friend or a neighbor with a 17 or 18-year-old son or daughter. So, Catherine, you're up. What's the point of an expensive liberal arts education for someone going into healthcare?
I think for me, there are a couple things that have been really, really helpful in my career. One is that although, as people on this call who knew me back then will know, I spent all of my time in the biology building in college, almost every minute of it. But despite that, what I really got out of a liberal arts education was a really strong foundation in both writing and communication, which have been critical in the work that I do every day. So whether it's writing manuscripts or writing grants, or really just leading a team and really understanding how to communicate with a diverse group of professionals and a diverse group of patients and families, I think those skills really came from my liberal arts education and have allowed me to not only succeed, but to really feel happy in the work that I do every day.
Okay, Brad, you have some comments here?
I might have a few. Yeah, it's interesting. It's like where to start. I didn't spend most of my time in the biology building. I spent a lot of time in the library. And I was a neuroscience major. I think I was the second class of neuroscience majors. And so we were stuck between departments, which I think was actually useful at the time, thinking across the different sciences, also humanities and psychology and social sciences. And so my friend base, my social group was very broad, and it led us to working on very diverse projects, including some from my class who might be here may remember resource and energy efficient living, and a bunch of us trying to make the college much more energy efficient and trying to get the college to use recycled paper and do something about our food waste and what have you. And frankly, the creativity we had and the mentorship we had from our faculty, and sitting with Harry Itagaki having tea on Friday afternoons by choice and talking about anything but actual neurobiology. We're talking about how it interfaces with the rest of life in the world outside of Kenyon. It was very pivotal for us, or at least for me, pursuing healthcare with a very wide lens, working in buildings, transdisciplinary teams, working interculturally. Professor Itagaki and my partner, Heather, who was a couple years ahead of me, suggested that it would actually be possible for me to be a neuroscience major and study abroad. And studying abroad in Nepal first semester in 2000 and looking at the interface between Tibetan and Western medicine and spending time in the emergency department in a rural district hospital really set the stage for me thinking about how healthcare really goes well beyond what we're doing in the labs or what we're doing, just even the basic hard sciences. But really it's about translational science, translational ideas, and working across different disciplines to try and figure out how do we go from knowledge to implementation and what we now call implementation science. So I think those are all significant framings. And frankly, the access we had to our faculty, Hewlett McFarland and I would be in the lab working until well after midnight or 1 a.m, working on projects. So that just doesn't happen in other types of educational institutions.
Let me make some comments why this is a question. We recently graduated doctors and dentists from Case Western Reserve University, and there are graduations going on all across the country. And many of these graduates are leaving their school with debt, maybe $200,000, $300,000. And I think that the current situation is not going to be sustainable. And there are voices in medicine sort of saying, well, why do we have to do this and saddle people with all this debt? So I think this is an open question. I'll see if any of our panelists want to jump in at this point on debt or anything like that.
Well, I was fortunate enough when I—
All right, one of our guests, go ahead.
I was fortunate enough when I graduated in 1990 that my grandfather had saved up, so I had no debt coming out of undergrad. I amassed all of my debt in medical school, and I have no idea how much it was. I unfortunately deferred too many times, and it took me a long time to pay it off. But the financial aid office, who, jokingly, the debt management person said that it was not uncommon, even then when I graduated in '94 from Medical College of Pennsylvania, for people to be starting with $10,000 in debt before they even started medical school.
Well, we've got some inflation on those numbers now.
Mm-hmm.
All right, so I see a hand up there. Go ahead, Ken, unmute.
So I graduated from Kenyon in '76, and I was fortunate enough to have had my tuition paid for by my parents. That was very lucky. But I went off to medical school and signed up for the National Health Service Corps and graduated debt-free with a obligation to do service, which I did working in a program to take care of homeless folks in New Haven, Connecticut at Yale, and then went on to the faculty there. There's still opportunities for significant debt relief, but I want to take that a little further and go to why a liberal arts education is important in understanding this. The reason that people are graduating with such enormous debts is because Congress, in its wisdom, decided that it was really important to saddle young people with high levels of debt to keep them from the turmoil that we saw of the 1960s and early 1970s. It was a specific political plot, to put it bluntly, to encumber a generation with debt that would keep them kind of nose down into the grindstone. So the reason I know that is because I've been reading about the politics of the 1970s, because I learned to think that way and think about why it is that things are that way from going to Kenyon.
So I can
Go,
speak
Brad.
also. As far as debt goes, I mean, I graduated from medical school with $280,000, almost $300,000 in debt, and I still carry a lot of it. And I could probably go pay it off, and if I wanted to go focus and down and just work clinically. But I feel like Kenyon really instilled upon us the obligation we have to society, right? And I think the privilege that I had makes me feel that my time is better spent trying to expand opportunities. Fortunately, some of our debt is relatively low interest. Now, students graduating, it's much higher, and it's not as wise to take it over the long term. I do believe that liberal arts students and others would welcome the opportunity for service instead of having high debt loads. I mean, I have residents now who them and their partner have close to $1 million in student debt, almost $500,000 each from private undergrad and then private medical school. It's unbelievable, and it makes them choose to go earn money instead of think about society and be more socially focused. Right? It's too much of a driver at this point. I think that's what was being got at with the previous comment. However, I do strongly feel that we as alumni and we as a community can better support our students in our communities, and whether it be using our voice or whether it be through fundraising, to create additional programs for funding and support. Right? It's not to say that the trajectory of tuition is sustainable. It's not. Our systems need to change fundamentally. Our funding mechanisms need to change. However, I feel like we can better support those who are looking towards a service-oriented career and do that effectively, or more effectively.
Looks like Catherine wants back in. Go ahead, Catherine.
Well, I'm going to play a little bit of the devil's advocate to make this a little bit of a provocative panel. I mean, I definitely agree that many of my colleagues graduated from medical school with staggering debt. I was fortunate enough to go to a state school. UCSF was, I was able to get in-state tuition. So I graduated with not too large of a debt burden, but I've watched colleagues who really struggled with that. But I'm still a physician. And so relative to some of my colleagues in the liberal arts, I think that I have the opportunity to pay off that debt. And I think about some of the young people who are coming into Kenyon who are pursuing classical liberal arts education and going on to non-professional routes, or who want to pursue fields in healthcare that maybe don't have the same reimbursement that being a physician does. That coming out of Kenyon saddled with that debt is really problematic. So yes, I will advocate for my physician colleagues, but I will also advocate for people who want to graduate from Kenyon and become a nurse practitioner or a pharmacist or go to nursing school, or some of the other really critical areas of healthcare, or to work in public health. So I think on the physician end of things, maybe we have things reasonably good, even though some of us do graduate with staggering debt. And I would like to advocate for really a broader representation of Kenyon graduates in the healthcare workforce. So that's my provocative response to that statement.
Thank you. And I could not agree more. And I do feel like the ability to have more exposure for our students across the spectrum of health sciences is crucially important. I didn't come from a medical family. I literally happenstance fell into healthcare as I volunteered at the fire department in Gambier, and they sent me to get my EMT. And then I serendipitously was working nights in the emergency department at Knox Community Hospital and had one of the emergency medicine doctors take me under his wing. That is the reason why I ended up in medicine. I just didn't have a frame of reference. And honestly, I think coming out of a panel like this or some of these alumni activities, think about how we can better mentor our students and not make it so dang physician centric. Because honestly, that was one of the biggest challenges we had during COVID. From the beginning to the middle, even in the end, when you say healthcare worker, most administrators, most policymakers automatically think of physicians and maybe nurses. They forget about respiratory therapists. They forget about our radiology techs. They forget about all the other members of the team, physical therapists, even long-term care facility staff that are integral into us taking care of our population. And as we think about population-based care, as we talk about the triple aim and moving towards the quadruple aim, we need to be thinking about team-based healthcare and how we have more exposure at the undergrad level. And even as my partner does, working in public health, exposure at the high school level for careers, especially in underrepresented minority populations.
So maybe just make a few comments to try and close out this segment of the discussion. And I'll say that, as my wife says, one size does not fit all. In my experience at Case, I had this one young lady who was just dynamite, and we're in a 8 a.m. to 10 a.m. session, and they're giving her a birthday party, and she's 20 years old, so she was a fast progresser. She probably took college courses in high school. So in a way, she's on maybe like a 6-year program. And not everyone in the audience may be aware, at least in the state of Ohio and elsewhere around the country, there are 6-year programs with state schools where you can accelerate through and save yourself some money. And at the other extreme, I've interviewed, besides sort of the straight arrows that came from 4 years of undergraduate right into medical school, I've interviewed people that went out and did other careers. I'm thinking right now of a guy that was in a startup in the Bay Area, made some money in advertising, but then decided he wanted to go into medicine. So we got all comers. So we're going to go, Brad.
I would just like to add that one of my biggest recommendations to students who are pre-health is really take additional time. Don't go straight through. The average entering age from my class at OHSU was 27 years old, which meant at 23, I was in the younger end. And I'll tell you, my classmates who had whole careers first or had really experienced more of the world very significantly added to my clinical education and my orientation towards a service-based career and really community-focused career. So yeah, different paths for different folks, but I really feel that being in a liberal arts or using a liberal arts pathway helps engender that and really builds the imagination for what could be in those years and how it might add to a health profession's career.
All right. All right, we got one hand raised. I see Michael Young. We'll go ahead, Michael.
So first of all, hello to my 76 reunion friends on here. Ken, it's good to see you. Bruce, I see you out there, Bruiser. I just wanted to offer maybe a bottom-up look at this. So when I was at Kenyon, I had the awesome opportunity to double major, and I did the splits across middle path by double majoring in English and in biology. And my hope was to head off to medical school with a little bit of a twist. Very interested in facial-maxillar surgery, and it just wasn't going to be. More so not because of chosen courses, but because of my performance in those courses. So the reality is I ended up making a 30-year career in the pharmaceutical industry. And I wanted to just share with the group that I may have done more good in going that direction than I did possibly following in the steps of my mom and going into, again, an OBGYN practice or going into even Bruce on your side of it, on the dental side of things. I've had the good fortune to be able to launch 20 drugs here in the United States and Western Europe, including some notable agents such as acyclovir and ciprofloxacin. So I've had a great career, which has turned into an amazing consulting practice opportunity here in the autumn of my working years, and it's all because I had a liberal arts background. It clearly gave me the opportunity to not only understand and appreciate the sciences, but because of the English degree, give me an opportunity to learn how to better communicate. And as a first generation American here with immigrant parents from China and Indonesia, to be able to competently speak the language and to communicate in writing wouldn't have happened without significant background from Kenyon. So in the spirit of Clubhouse, I'm Michael Young and I'm done speaking.
Okay, we're going to transition to our next bullet, which is COVID and our pandemic, and which Brad has already mentioned. Brad has got some experience to share, so why don't you go ahead, Brad?
Oh, yes. So I think my Heather, my partner, and I were actually planning on giving a joint talk in Colombia in the beginning of March. And we were supposed to leave March, I think, 6th. And the travel ban came down about 18 hours beforehand. And up to that point, we had been watching the pandemic march across China to Italy. And having been through H1N1 and SARS, et cetera, I was an anxious ball of nerves wondering, okay, how is this going to affect those of us in the front line? And so when our travel got shut down, I had a solid week and a half of just reading and immersing and coming together with some of my colleagues across health sciences and social sciences and trying to find, what can we do, right? China is housing their healthcare workers. We're taking care of their healthcare workers, trying to protect them and their families. And they did an incredible job. Italy started working on the same kind of situations. So we created a nonprofit. It started as essentially a think tank with our medical anthropology colleagues. I think Mark Nichter is actually on here as well. Public health colleagues, our data science folks. This is from University of Arizona, but also from around Tucson. So really got involved in the community and tried to figure out how can we best support our healthcare workforce. And so came up with programming to do so, whereby we were housing healthcare workers in donated housing and in hotels, providing psychological first aid and other services, and then psychological and physical health monitoring. And through that process, HCW hosted a nonprofit, and I'll put the link in, provided a lot of services to people who were helpful, but more than anything, we learned from healthcare workers, from our environmental services, who are otherwise known as our janitors, to our nurses, to our physicians, our respiratory therapists, nursing students, medical students, others who stayed with us or used our services in some form or fashion. We found out, that psychological safety is scarce within their healthcare organizations and within their hierarchies. And two, it's not about just them as the healthcare worker, but also about their families. And how do we support their families? And since the pandemic is now waning finally, we're pivoting towards working with employers to better articulate the value of the healthcare workforce, because the turnover was incredible. For anybody who's listening, who is in the healthcare space, saw the huge turnover, up to 100% in nursing, and long-term care facilities, 400% in 1 year. One position would turn over 3 or 4 times because people did not feel safe and supported. That's not tenable. We were paying nurses $10,000 a week to work in the ICUs. These are not compatible with community health or with public health or with our corporate healthcare models. And so we need to be creative in moving forward. And that's what many of us are working for. Heather Green, Dreifuss, Katie Crum, and Timothy Shu are all Kenyon alum as well. We came together with our partners to do this. And I think it really speaks to the strength of the Kenyon identity, our ability to problem solve and work as teams. And I can honestly say both my research, my education, and my leadership development really was started at Kenyon. And so, not having been at Kenyon, I can solidly say we wouldn't have come up with a new model, and we wouldn't have come up with the advocacy programs that HCW hosted was really working on. One thing I will mention as far as writing goes, I don't think anything could have prepared me for what came after writing a New York Times op-ed. And it's something that I will say to students and anybody who's thinking about writing in the future, you need to have a team if you're going to be engaging at that level. It's been a truly humbling experience, and one that I think I'm sure I will take with me, and hopefully others will take with them moving forward, and realizing that, hey, we can make a difference by using our voices and by working together in transdisciplinary ways.
Yeah, I wanted to make a few comments on my COVID vaccination clinic experiences. In these vaccination clinics, there are physicians participating, but they're in the minority. This is where nursing, pharmacy, EMTs, and others really step up. And the ones I participated in were at Case through the city of Cleveland, and another different site through Cuyahoga County. And this sort of gives me an idea for the Kenyon staffers on the call that maybe you can get Kenyon students involved with the Knox County Department of Health to give them some exposure. Hopefully this won't be for a pandemic, but these county health departments could probably use some help. And the other cute thing when my wife got hers at the Cleveland Clinic, of course, we know a lot of the Cleveland Clinic staff doctors and had married nurses, and a lot of these nurses came out of retirement, put on their whites, and they were so happy to be involved again, and as I was in my experience. So I want to see if anyone else has any COVID or pandemic comments or questions before we transition to our next subheading.
I guess I'll throw out there, and this is somewhat of a shameless plug, but both HCW hosted and Global Emergency Care, which works in capacity development in Uganda and internationally, We'll be very excited to work with other Kenyon alumni, as well as Kenyon students, providing opportunities for internship and collaboration, because we are stronger working together with a diversity of lenses with which to problem solve than working alone. So I'll put my information in the chat.
All right, I saw two hands go up. One, there was no face on the screen, and let me see if I can still find it. Bridget put her hand up, but I don't see it. And oh, there she is. Go ahead, Bridget. We'd like to see you.
Hi, I would share, but I just came home from work and I'm recovering. I just wanted to, I'm sorry I joined in a little bit late, so I missed a little bit of the beginning, but I appreciate the company in this. And I'm a physician, a pediatrician in Lower Manhattan, and I was a international studies major at Kenyon. And, really we were in the thick of it and continue to kind of evolve with it. But teamwork, like you were talking about, was a really big part of it, but also like I think the skills that just the experience I had to be an ally for the population that I'm working with, just my experience in Central America and language skills and my understanding of the historical and political situation of a lot of my patients and a lot of the marginalized communities that we serve, and to be able to be an ally in that particularly very difficult situation was something that Kenyon really, it really prepares us to be, right? And I think with a broader, like a broad background and understanding, and that's being able to lead and see problems too, and how to kind of figure out how you're going to solve them that might not all be medical, right? And working with a team and things like that. So I probably have a lot more to say, but that was just wanted to share that.
All right, I see Catherine has her hand up. Go ahead, Catherine.
Yeah, I love what you said, Bridget. And I think that I would extend that by saying that our experiences from our liberal arts education outside of the sciences really give us rich experiences which allow us to think outside the box when trying to solve problems in medicine. So often when we are looking to solve a problem, we solve through analogies or analogous situations. And so having exposure to the liberal arts and thinking about other perspectives, I think allows us to be more innovative when we are trying to solve problems in medicine, whether they're related to scientific problems themselves or whether they're related to the problems of our population, of the patients that we are and families that we're serving. So I really liked what you said. I think it's highly relevant. I also agree that sort of the teamwork component related to COVID is so critical. Because I work in a pediatric facility, we were very fortunate not to be inundated with patients with COVID. But we still faced, I think, a lot of fears. And we had a lot of difficult decisions to make for our patient populations. We were required to shut down pretty much all elective surgeries. And because I take care of kids who are really vulnerable with complex congenital heart defects, we had to make really tough decisions about who we could bring in and who had to wait for their care. And I know that people all over the country and all over the world were having to make these types of decisions. So one of the things that I felt was helpful in working through those was the perspective taking that I learned through my Kenyon education. The ability to look at things from many different angles, to understand the different challenges that different people are facing based on their socioeconomic background, their geographic background. We get patients from all over the world into our program. And so I think my Kenyon education prepared me to look beyond the numbers and beyond the, who's most likely based on the scientific data to have a complication if we delay their surgery, but to also look at all the extraneous factors that are really important in those decisions.
Okay. We're going to go to our next topic. It's diversity. And how can we help Kenyon recruit and retain a diverse student body? And so I'll start with my panelists. Whoever wants to go first. I still see a hand up with Catherine, so I don't. Catherine's
And that's
muted.
only because I failed to lower it.
Oh, okay.
But you know, I think that you know, recruiting diversity applies not obviously just to the sciences and to the pre-health, those who are interested in health professions, but I think really broadcasting the idea of the liberal arts education, as I just mentioned, is to a way to really understand perspectives from all different angles. And that's the beauty of a liberal arts education. But obviously, I think that there are different ways to think about diversity. And we talked about this a little bit when Jim and Brad and I got together to talk about this call ahead of time, that diversity applies not only to thinking about traditional sort of socioeconomic and racial diversity, ethnic diversity, but also thinking about promoting diversity in the healthcare profession. So we commented when we spoke together that here we are, 3 physicians on this call. And then I look at those of you who have contributed to the chat who are coming from all different healthcare fields, you know, whether that's I think I saw a comment from a nurse practitioner. I know there's a dentist on this call. That really one thing Kenyon can do is to really try to form connections for students who are interested in the healthcare professions in very diverse ways, rather than just saying, here's an alum who's a physician who we can pair you up with, but think about all the ways that we can serve in healthcare for, you know, for our populations and our communities.
Brad's hand is up. Go, Brad.
First of all, thank you. I couldn't agree more. And I would just add that we need to be thinking about the responsibility we have as, for those of us who are physicians, to be calling attention towards the fact that we shouldn't have such physician-centric recruitment generally. The fact that we can create mentorship programs that are much more broad. That as we're talking about diversity and inclusion, not just at our institution, but where our students are also going if they're studying abroad, thinking with a decolonialized mindset, or trying to decolonialize influence, understanding our intersectionality and privilege, and what the responsibility that comes with that, and exercising that in the classroom at Kenyon, exercising that in our recruitment for students to Kenyon from across the country and underrepresented demographics. And those of us who are thinking about donating and how we want to donate resources to Kenyon and how we may want to earmark it for scholarships for underrepresented minority students or for students interested in X, Y, or Z. We need more non-traditional students going into liberal arts, right? To then move into the professional fields if this is going to work long term and be able to be scaled.
Yeah, I'll just make some comments since I'm the gray hair of the panel. Yeah. So when I got to medical school in 1970 and hit the hospitals in 1972, and back then we had what one of my colleagues at Cleveland Clinic by name of Jim Young called the gladiatorial model of healthcare. It was the doc. He was out there alone in the arena, and healthcare has transitioned to teams and with all different sorts of people, and so the diversity it's there. It's quite important and needs support. And I can say when I was a patient in New York City and got acutely ill on a trip, I saw a lot of diversity and it was taking care of me. So I'm looking now for anyone else that wants to jump in the audience on this diversity question or anything else.
I have a follow-up question to that. You talked about how Kenyon can increase diversity amongst the student body and in our alumni, but can you speak to why, like why that's really important? I think you guys touched on it, but why diversity of thought on campus, is important in a liberal arts education as opposed to just how?
I think from the perspective of healthcare, we need diversity in our workforce if we are going to serve a diverse population. I think it's really as simple as that people are going to feel more comfortable coming for care if they feel they're coming to someone who comes from their background, who understands their way of life, who understands their culture. So I think that's a very basic reason.
I think even, obviously 100% agree with that. I think even in the classroom at Kenyon, diversity of socioeconomically, racially, ethnically, orientate, like across the board, where people are from geographically is exceptionally important, and breaking up our islands of blind spots. Our blind spots are like islands. I think especially in the Midwest, where arguably most of our students are coming from, or whether it be the relative socioeconomic privilege that most of our Kenyan students come from. Just in the classroom, having debates and discussions with a much broader lends itself to an understanding that helps battle that implicit bias, where people may be more willing to venture into, or I'd say out of their comfort zones, and studying or working and immersing themselves in ecosystems that are very different from where they grew up, right? If we don't do that, if we don't foster that, if we don't create and allow for a healthy debate and challenging of our paradigms and understandings of our implicit bias, we're missing the point when we use the phrase implementation science, right? Just because we know how to treat something, or we think we know how to treat something, doesn't mean that we can get patient populations to do so, because we don't A, look like them, B, understand them, and C, many often just don't care in healthcare. And that's a problem. That is a fundamental problem. And so creating a diverse workforce and creating a diverse learning environment and practice environment is what's key. Because I mean, Heather can tell you, and most of my close friends can tell you, that I'm very vocal about the fact that I've learned more from my Ugandan colleagues over the last 10 years, and Ghanaian colleagues than they have ever learned from me. Number one, when you think about it sociodemographically, there's just no comparison. And in resource limited settings, those who make it into those positions are freaking brilliant, right? Our colleagues abroad who often get the short end of the stick on our grants, and a lot of us are fighting for equity and funding, equity and authorship on manuscripts, etc. The amount of insight they have and the maturity, professional maturity they have, way outstrips most of us coming from the West, and particularly coming from the States. And that's something that I feel that if we have a more diverse classroom, we'll be more widely understood, and we will have more equity that results from having a more diverse learning and workspace.
Yeah, I'll take on Katie's question. I'll just say this. The Kenyon that I went to in the late 60s, along with my classmate Jim Finn, who's sitting there in the audience, was, I am sure, a lot less diverse than the current Kenyon. And I grew up in a nice eastern suburb of Cleveland. But imagine the shock to my system when I'm a third-year medical student and find myself in the emergency room of Metro Health Medical Center, a public hospital in the city of Cleveland, the only one in the level 1 trauma center. And that was a good shock. And so, you know, we're hoping that our current Kenyan generations won't require that sort of shock of reality. So,
And Jim, if I could, you know, I think you'd all be happy to see that the student body of current Kenyon College is replete with students of color and quite an international student component. And within the United States based students, I know California and I believe New York are 2 of the top 5 feeder states to Kenyon College. So it's not just the Midwest anymore. It's truly national and international. So FYI.
thanks, Jim.
Yep.
And another comment to the the Kenyan staffers that are on the call. So, you know, as some of the interviews applicants, of course, I see a lot of undergraduates coming from name institutions in urban medical centers, and they've had opportunities to be in high level research labs and come in accomplishing quite a lot, presenting themselves to medical school. But Kenyon has a chance to deal with rural medicine and its problems, the problems of the fentanyl epidemic, which is really hitting rural America hard. So any way that Kenyon can facilitate its students to interface these areas would, I think, put them at a real advantage to come into a interview and talk about those experiences. Right, Ken?
I think it may have been Brad who talked up the fire department and the ambulance squad. I'm also an alumni of that. And I will say, I think one of the things that was really helpful about Kenyon and has informed my understanding of work that I do as a physician is that it allowed me to understand what makes an organization like Kenyon function in a small town like Gambier. The whole sort of idea of all the stuff behind the scenes, not just on the academic side, but within the farmer community outside, within the connection to Mount Vernon and the economics that were the United Can Company or whatever the heck it was, I can't remember right now. But the sort of feeling of a whole community that you could get from being at Kenyon and being engaged in service to it in some form or fashion, I think is an extraordinary opportunity for Kenyon students to take advantage of. So just following along with what you're saying, for students who are going into health careers to have some connection to the community that they get their education in and pay back in some fashion with service, I think is highly laudable and also will go a long way in terms of opening their eyes to what they're actually going to be doing when they try to help people.
I see Michael.
I just wanted to, thanks, Jim. I just wanted to reinforce what Jim Finn brought up. Certainly when people like Ken and Bruce and I came onto campus in 1972, I don't mind sharing with you that I think I was one of 2 Asians on campus at that point. We lived through the time of the establishment of the Black Student Union. I think that we have a lot to be proud of and a long way to go, but a lot to be proud of in terms of the way in which Kenyon has diversified and brought much better equity to not only a racial balance, but certainly a curriculum balance. I see a lot more in what the Kenyon experience is related to being in the world. And I really think that's the value of a liberal arts education, is placing yourself in the world as opposed to learning about the world. And a lot of credit to Sean Decatur, both by representation and by the mission that I see when the elections come around, when I see the response to the pandemic. It's been, really a point of alma mater pride for me when I talk to people about Kenyon. And certainly I'd like to believe in my own small way that I've helped increase the visibility of a small liberal arts school on the Hill out here in California, and participate, getting a number of other colleges, a lot of high school students to take a look at that. I've been actively campaigning to do that out here as an alumni advisor. So yeah, that I don't, Katie, to your question about that, it's up to us, those who have come from that learning environment, to go out and proselytize, if you will, for the experience that could be had at Kenyon. And that's basically, in my own small way, that what I've been able to do. I'm not going to be one of those great C students who leaves $1 billion to the school, but I am going to try and do my very best to leverage the experience and the learning that I had there, because in point of fact, that's where I grew up. I grew up at Kenyon. I didn't have that in a high school experience, being a first generation kid in Columbus, Ohio. So very grateful for it. And hopefully that helps all of you understand how at least I see this.
And Jim, I don't think as a host, I can raise my hand or I can't figure it out, but I wanted to call everyone's attention to the chat because Lindsay shared a link to the website that explains the Office of Community Partnerships, just in the talk of Kenyon integrating itself into the Knox County. We actually have an office for that. It's in the Wright Center downtown. And the whole purpose of the Office of Community Partnerships is how do we integrate our students into Knox County, both in healthcare and then outside of. So our environmental studies major, they serve in soup kitchens. So you can read about it. It has become a priority for the college on how do we get our students off the Hill. And so I just wanted to, if people are interested in how Kenyon already works in the community, there's a great website that'll kind of explain it more articulately than I did.
Awesome.
Excellent. I see a raised hand. It looks like Ken again, or you want to come in, Ken? Okay. I think we're,
I do have a question.
all right, go, Brad.
I have a question for the Kenyon faculty who are on here, and especially those who are in sciences and social sciences, or and working with students who are going into health sciences. And I'd like to know from them, I'd love to hear from them what their thoughts are on how we can better be a more supportive alumni community from their perspective.
Well, I guess I can speak for at least for me. I think you're all doing a lot, right? I just had one graduating senior, one who just graduated, link up with two scientific writers, right? And these are people I've taught, and one is now on the editorial board of Nature, which is arguably the most prestigious journal out there. And so we have connections, and you're more than willing to to help, and that's what we need, is your willingness to actually engage with our students in a meaningful way, because Meg could go to a bunch of people whom she doesn't know, but this Kenyon connection is really pretty darn special. And I think just because you understand, especially if you're going into writing, that we've actually put you through the paces, you put the students through the paces, there's actually a level of comfort for people, especially in something like the writing professions, to say, okay, you can probably do the job. Well, let's see what you can, what else you can do. And so, I think your willingness to engage, just by being here and spending an hour of your time is a pretty good indication that you care enough about the institution. And, as people were saying, things have improved. Things are not if you see this great big honking library that's going up, so it'll be done in July. It's a far sight from the old Olin library, or even before that, I forgot what the backside of Olin used to be called. But anyway, and so I just think that this is a institution that I've been proud to be a part of for 31 years. And one of the nice things about it is that it's continually improved, and you know, and much of that comes from all the alumni support. And so I thank you for it.
Thank you.
Get your hand up.
You know, I feel I'd be remiss in getting off this call without speaking of the huge debt of gratitude that I have for Kenyon. You know, not only do I want to think about what I can do as an alum, but I also want to say thank you. I think about, I spent 2 summers on campus as a summer science scholar. I think Dr. Itagaki, you had just started maybe in my sophomore year, I believe, or my junior year. And those summers were formative for me. They helped me really think about what it meant to do science, how I wanted to shape my career. And I think that's something really special that comes at a small liberal arts college. Those opportunities, the opportunity for very close interactions with faculty that I think are much harder at a large institution such as the one that I'm at now. And I am just so incredibly grateful for the education that I got and for the opportunities that Kenyon gave me.
Amen. I can say definitively that it was Harry Itagaki on I took a trip up to Kenyon randomly to go visit some friends, and I think we met on Middle Path and we just started chatting. And then we ended up in your office, and I ended up applying early decision. And that was just the beginning of a very, very long relationship. And yeah, anyone who knows me over the years can sees the influence, and really thank you. And it's not just Professor Itagaki, it's most of the faculty, if not all the faculty that we interacted with. And I just wonder how does that magic get grown?
And Jim, we have a question from someone submitted from the chat that I wanted to just bring to your attention. They said,
Great.
Knowing what you know now, would you go back and change anything about your college experience?
Panelists.
Maybe a little less time in the biology building and explored a little more outside of it. No, I don't think I would change anything, actually.
Yeah, there's not terribly much. I think I would have taken more writing courses. I was always really intimidated by my friends were English majors who were just, their writing was ridiculous. And I was like, I wish I would have had more mentorship in that regard. But really, I treasure the time I spent in the labs late at night with McFarlane, who I think is on here today. I still owe him a CD from, he gave me a CD for graduation, right? Like, where else does faculty actually take as much interest in your musical education, right? As well as your science education and your human development. It's pretty amazing.
Yeah, I had a fair amount of time in the religion department with Don Rogan and Professor Kuman. They didn't make me very religious, but maybe somewhat religious. Maybe I could have taken an economics course so I could keep up with Jim Finn a little bit better.
Stop that right now, Jim.
Yeah, Jim, I'd just jump in and tell you that Frank Yao, who was one of my terrific biology professors, one time we were outside, doing a little ecology thing, and he said to me, he goes, one day you'll find out, Michael, that the farther you go out into the woods, the more Kenyonites you'll run into. And I didn't realize he meant literally. So.
I had people around Tucson who, I put stuff out on Twitter and Facebook about this session. And there are people around Tucson who are like, I went to Kenyon. It's like, whoa, there's way more of a community around. It really is a rally point.
Well, this has all been great.
I said,
We got a couple more. Go ahead. Catherine,
I can,
do you have something there?
yeah, I'd like to thank, my cousin who got me involved to go to Kenyon. It was, of course, I thought, well, big school, small school. And he told me about, Robert Burns, one of the biology professors. And when I went down for the interview, I bumped into him and got hooked on Kenyon. Really like the program, and the diversity is just unbelievable now. When I've gone to campuses and taking a look at the student body there now compared to when Mike and I and Ken graduated, completely different. But it's a big improvement.
Bruce is my cousin. Bruce, do you have any comments from the dentistry aspect? We've been all physician centric.
Yeah, not much in dentistry. I'm in private practice, but when COVID hit, I had to shut down for 8 weeks automatically, and then try to just beg, borrow, and steal PPEs so I can see emergencies during that shutdown period. Where my wife was, my assistant. She's also a dentist, and so one day a week I'd be at her office assisting her, and one day a week she'd be at my office assisting me. But it got myself busy, and patients are finally starting to come back in. A lot of leeriness about can it be spread from dentist to office to a patient, and it's really, I think, the lowest spread from dentist to dentists and dentist populations, like less than 1% of exposure. So I think we've learned better from protecting ourselves from AIDS and hepatitis, how to dress ourselves and keep our hands clean. But I think that's it.
Okay. It looks like we're winding down here, and I want to thank my fellow panelists for a great job, and I want to thank all the attendees for being here. It turns us on, and I don't know. Michael has got his hand there again.
No, that's an applause sign.
Oh, okay. All right.
I just want to say thanks to all of you. This has been really enjoyable, and it's great to meet many of you and say hello to past classmates as well. Bruce, we'll talk soon. Bruce is actually an apartment mate, so.
Yeah.
Yeah, I want to just ask the staff, do you evaluate all these activities? Or are we going to find out how we can do better?
So that's not handled through my office. I'm going to do my best to answer, but yes, of course. So we look at, everything with the virtual reunion, where virtual reunion for us is a little different, obviously. So we're going to be evaluating all the panels and how we did everything this year, and ways we can continue with the virtual programming going forward to make people feel even more tied to campus, in addition to when we start in-person events. But I also just wanted to thank everyone for attending, but also for Catherine and Jim and Brad for taking the time, both tonight and before tonight, in preparation. This is really interesting, and this is why I love Kenyon, just spurring this kind of conversation. And the pride of all of you, I think it's so amazing that you all went there and have so much pride in your school. It's a wonderful thing to see.
I think
That's
that's
without
I think that's a good note to end on. And well, let's hope we can see each other live maybe next year.
Here's
Thank you,
hoping.
That
everyone.
would be nice.
Thanks, Jim. Thanks, panelists. Much appreciated.
Thanks
Take
to
care.
everyone who came.
Everybody
care.
have a great evening.